Yeah, Senator Shanley. Yeah. There we go. Senator Shanley, if you want to go further.
Okay, thank you, Mr. Chair, and thank you to the House members. This 574, the underlying bill, passed both the House and Senate. It was on House consent, and it had the language prior to it. The consent was taken off consent. The language of House Bill 185 was put on, but the House and Senate have now agreed to House Bill 185. It has passed both chambers. So I would like to suggest that we just take the language of House Bill 185 off of this bill and agree to pass SB 574 as it passed both our chambers, if that's acceptable to the House members.
Representative Ball had a concern she mentioned to me.
Yes, good morning. I'm a freshman, so please bear with me. This is all new. My concern
You're
is,
doing very well as a freshman, by the way.
thank you very
I'd love
much.
to say it.
I appreciate
She's
that.
my state representative.
Thank you. My concern is that although House Bill 185 has passed the House and the Senate, it has not been signed by the governor. So this is why I would suggest that it be left on this bill as, in no other words to say it other than the insurance policy to assure that we get this through.
I do, so, Mr. Chair,
Go ahead.
Go ahead, you go ahead.
Thank you. I'm also not, I'm in agreement with Representative Ball. I don't see a need to take this off if both chambers have agreed to it.
I would suggest we take it off because the Senate version with which the House concurred is somewhat different. So the 185 as it exists in this bill is not something that the Senate would support.
Why don't we take that? Go ahead. Senator Evans.
So, Representative, there was a time where I agreed with that exact strategy. I've only served as a representative and as a senator with one governor in the corner office. So I only can speak from my experience with that particular governor. My understanding is that we've done that with other bills in the past, and rather than one passed, they both end up getting vetoed. I was surprised to see that. So I would say that if that's the worry here, I would recommend maybe communicating with his office as opposed to attaching to more bills. And what's more likely to happen, if that is the case, is that the rest of this bill would also go down with it. So I think if we pass the 185 separately, that we maybe want to send them separate. Because I don't think that the pressure that people speak of is going to make a difference in this case. That's just me basing it on prior bills and prior experiences. So I don't think we should send it there with the hopes that the person, it may get signed because it's attached to this bill. Meanwhile, the other one out there. That's just in my experience. I can even name the bill that happened with if you'd like.
The bill as written is the one that we concurred on. So I don't see a reason to change it at this point.
Well, I think what the point I'm making is, if for some reason the one part that we concurred on does not become law, if that's attached to Senate Bill 574, what will happen is, and this, I supported 185 in its original form. I supported the amended form, so I support the policy. I'm just saying if there's a concern that it may not get signed into law, all I'm saying is attaching it to Senate Bill 574 is not going to, I don't believe, have any impact on that at all. I think if the policy is accepted, it's going to be accepted, or it's going to be rejected. And then I think what we would have to do is, there's a chance to, it's a procedure to get around that veto if it happens, but we're not there yet. I think we're speculating.
Go ahead.
Thank you. I'd like to point out that just to go back to House Bill 185, that House bill was reduced to only 4 words. It was a much larger ask when it was originally proposed to the House, and we brought it down to 4 words. This is something that we've been working on or past representatives have been working on for 25 years, based on studies that were done. This was a recommendation. And my concern is, again, given the feedback that we've received from our constituents, I don't want to do anything that's going to jeopardize getting this through. And it's my understanding that it was hard to get the House Bill 185 through with just the 4 words. So I don't want to put all my eggs in one basket.
So to be clear, the version with which the House concurred is slightly different. I don't believe that I have a copy in front of me, but we could.
And Mr. Chair, if they're slightly different and they both got signed into law, that would also create a unique problem. So
Yeah.
it would, whatever one signed second would actually become, that would supersede the first one. So
But the 4 words, at least 3 of them are left there, which is the approximately equal parent, well, that's actually the 4 words. We only change from support to encourage, which we don't have a problem with, but those approximately equal parenting time are the 4 words. And that was the amendment that I put through. And we wiped out everything else and brought that original proposal down to those 4 words. And I don't think it would be fair to our constituents to do anything to jeopardize that. And if it means leaving it on here to assure that it gets through, I think that that's something we need to consider.
So the Senate version says, includes the language that in a particular case, it is not in the best interest of a child to. It requires, I'll read from the start so it makes sense. Because children do best when both parents have a stable and meaningful involvement in their lives. It is the policy of this state, unless it is shown that in a particular case, it is not in the best interest of a child to encourage approximately equal parenting time between each child and both parents. And it restates again, or it restates, if it is in the best interest of the child. So it makes clear twice that the best interest of the child is important. That is the version that was passed. It is not in this version, and the Senate cannot accept this version. I think Senator Abbas makes a great point, that if we send conflicting bills to the governor, we are then creating a situation where it's almost incumbent upon the governor to reject one or both of those pieces of legislation, and we could lose what is ultimately some good legislation.
I understand what you're saying. And respectfully, I believe it in the best interest of the child, as mentioned in the whole other portion, in another section where they talk about domestic violence, that it's already in the law, that it's always in the best interest. We always make our decisions in the best interest of the child. So including that, as the Senate did, really, in my opinion, it's fine that was there, but it was already there. So I don't think that that's a substantial change or a substantial difference from what's already stated.
We could just add the best interest of the child to the HB 185 portion.
I think that is not, my colleagues and I can speak about it, but
so we're all speculating that we want this to become law. So we all want everything here to pass, right? So we should be able to agree on something. There's a fear that this won't get signed into law. Is anyone basing that on any public statement made by the corner office? Because if it's just speculation, whatnot, I'm not sure we want to do that. Do something different.
Right, so if, I don't see any reason why he wouldn't sign it as it currently is.
And if I may, thank you, Mr. Chairman. You're putting in jeopardy the bill, the temporary agent bill, which I think our constituents are much more concerned about that.
But if it's one thing, if there's some concern that he won't sign it, if that's the case, if they're not going to get signed, I think they're both going down as opposed to becoming law. So I'm wondering, is there anyone basing that out on anything other than just, it's a possibility? Because I mean, that's a possibility with any bill.
Right.
respectfully would say that I'm basing that on how difficult just getting 185 through the Senate was. And so I don't know if we have the Senate support to help us push that over the finish line at the governor's desk.
I understand what you're saying. But I think at this point, it's a separation of powers issue. I think it's off. If the Senate wasn't going to support it, I don't think it would have passed.
Right.
The other version would have passed. I mean, I know it took a lot of work. Trust me, there's a lot of things that take a lot of work that don't always pass. Don't get me started. But I just think leaving it in for that reason, I don't think it's going to have any impact.
So what is the purpose of taking it out?
It's, well, number one, the language, there's a conflict in the language, but two, whatever slight possibility is, if one did not become law, you would lose the entirety of the other bill. I don't think it necessarily makes sense to do that if we want that to pass. When I walk away, I'm not saying we do that, I'm just saying we wouldn't want to risk losing that. If anyone was here last term, the good old gun line bill, and then there was the snowmobile provision added to it. And everyone thought, oh, well, there's no way that won't get signed into law with that attached to it. Well, the original one went down, as did the one with the snowmobile provision added to it, which they, in fairness, were unrelated. But adding stuff to it had no impact. So if that was the case, I see this not holding any weight. It's just creating confusion because of the different versions, but also why risk this, however slight chance of losing the underlying bill?
So in a different term, the governor signed an omnibus bill that included the divisive concepts, which is now being challenged by the Supreme Court. So I really don't think that in that context that this bill is in jeopardy.
Well, that was HB 2. That's different. I think when it's the budget, it's a little.
A question for the chair. After a bill is passed, both houses, how does the governor have a determined amount of time to sign it?
5 days upon delivery.
Is that what it is? 5 days upon delivery?
No.
Once
No.
it's delivered to his office, then it's 5 days of.
Sure.
If it's not vetoed within 5 days or signed, it will automatically come.
Go into law.
That's in the Constitution.
What day are we
It takes
on?
time to get there.
What day are we on presently?
We're not on any, we don't know, because it does take time. The bills have to go through the
Enrollment
process
process.
and such. But I do think there does also become a hierarchy in terms of which bill is signed last or first. But I do think that's part of the process of confusing the issue.
Yes.
There was a really good underlying bill, 574, that I think that we all agreed on. There was very little discussion and debate once we had the input from the various stakeholders. I would like to see that bill passed. I know it's important to a number of people. And I think that the attachment of a bill that we already, essentially, that has already been passed by both chambers and sent on its way can be problematic.
Go ahead. Now, I wasn't in the House when this was attached, but I thought this was attached to get the Senate to pass it. And the Senate did. That's the other part. I understand that's strategically well played. It happens both sides, right? But because it passed, but now we're insisting on leaving it in, but is that really the direction? We're just leaving it in to leave it in. Now, what will happen is if both sides concur, and if we leave it in, whenever the Speaker or the Senate President deliver it, because this is a Senate bill, I believe the Senate President will deliver it. Once it gets delivered, and this may sound old-fashioned, but it's 5 days, it sits there. If it's not signed, it becomes law automatically. If it's signed with a blue pen, great. It's now law. If it's signed with a red pen, it's vetoed. So if you have this, and then you also have now another version on a House bill, if that gets delivered after, it's going to either supersede this or this means, depending on when they get delivered. So I guess in one, we should pick which language we like better, because if they need to be at least the same.
So they're different.
I have a concern. I'm sorry, I'm going to interject. My concern is it was just a statement that said that the underlying bill here is very good. And to me, that implies that the added 185 is not good. So I'm a little concerned with that because that is telling me that the Senate doesn't support 185 and it's not going to help.
No, I think
There
the
it
Senate, so if the Senate fully supports 185, we're glad it's went through. It's just going to jeopardize her underlying bill to have it twice. And so we were total support of your bill. It went through. To put it here jeopardizes her bill because now you have two different issues. Either one.
They're
of
not
which could say
substantially
not
different. There's a
substantially
difference in one line. So, that's my thing is it's like, it shouldn't kill your bill. It's not substantially different. It's that one line, which is already in the existing law, that everything has to be made determined on the best interest of the child. So if that's the only difference between the two, it's not to me substantially enough to worry about that would somehow jeopardize your underlying bill.
Go ahead, Senator Ellis.
I would say if it has to stay in order to save the underlying Senate bill, it at least needs to have the Senate language in there. So then one won't supersede the other because they're exactly the same. All right, which I still think we're not really accomplishing anything with that, but the only thing that could potentially happen is, I guess, the underlying bill could go down if it's not signed with the color pen
I'm not
law.
very confident in the other.
That's
in the
really it. And
185.
if the language is the same, we don't got to worry about them superseding each other. That's
So
my
then
point.
let's
Right.
make
Go
the
ahead,
language the
Representative.
same.
So here's the thing. Both bills have best interest of the child. Both bills say approximately equal parenting time. So while they are, going at different issues regarding what is in the best interest of the child, it's still both. They're not like night and day different. They're not like a snowmobile bill attached to a whatever it was, the example that you gave. So they're still like related.
The one passed, HB 185, is going to the governor's desk. So we're going to send him now potentially another bill with similar language that is supposed to accomplish the same goal, but it's written differently. That subsequent language will then supersede what we already sent to the desk. And all I'm saying is if we're going to send the same thing twice, why don't you just let the language be the same? It's not saying I voted for 185 in committee in its original form, but at the same time, I'm being practical in the sense that it's bad policy to send conflicting bills with conflicting language that does the same thing. Because then what exactly is coming into
Could
play?
we just instruct the governor as to like, oh, well, we amended this 185, now this one's in play.
Did you say that we can amend this one and just align the language?
You could adopt the language that the Senate passed for 185 and leave it in here. I still think that that's a unnecessary verbiage to be sending out there. But if you do it, it does need to be the same. Oh, I won't
Do you want
support
to
it.
say something? We're going to take a 5-minute
Yeah,
recess.
and the only thing I want to say is, just to be clear, I don't want to be given the wrong impression. I didn't support 185 as it was, came to us, and I was not thrilled with the amendment as it was passed, but I am here to represent the Senate's position, so I do want to be clear that I will work to represent the Senate's position, but I didn't want to give the impression that I had voted in favor of
Thank
185
you for
in the
that
committee.
clarification. I appreciate that. Okay.
Okay, we'll take 5 minutes. Thanks.
Where you guys going?
My office right over.
Wow,
That's why I have an office right there.
that's pretty cool.
I remember 10 years ago, you took me when I was first a rep. Remember you walking me around and introducing me to everyone? Do you remember that? Okay. Doesn't seem like 10 years ago. I look the same, right? You do. Okay, so 185 we see as compromise language. It was passed by both in the houses. Sharon Carson, the rest of the judiciary, the advocates met, the courts met, and the Senate and the House, and our legal team crafted this language, and this is what we support. I think, Senator, do you have more to add?
Sure. Thank you very much, Mr. Chair. And, you know, we are concerned the governor will veto this bill if you do not take out, if we don't agree to take out HB 185 language. We all agree that SB 574 is a good bill. The Senate and House agreed to the amended version of SB 185, which is on its way. And if we all agree that the underlying bill is a good bill, I think that we can also agree to take HB 185 off of it. We cannot accept SB 574 with SB 185 on it.
Senator Ellis?
And just to clarify, just any comments, I have not heard any thumbs up, thumbs down from the corner office on this, so I have no belief that he will, or I have no idea what he'll do. I haven't discussed with him. I haven't made any attempt to discuss with anyone in his office. All I'm saying is that we're going to send, I really don't support sending the same language twice that's already passed. I think at that point, it's that language being attached to this Senate bill served its purpose. The idea was to try to get some version of 185 passed. That has happened, and it's on its way to his desk at some point. So that's accomplished. And I guess the question is, what do we want to do with the underlying Senate Bill 574? Do we want that or not? I mean, it seemed it passed in the House. It seemed that they didn't have a problem with that language. They attached other language to it just to kind of accomplish a certain goal. I think that goal's been accomplished. So now the question is, do we want to keep 574? I hope we do, but I don't want to send the same language twice, or especially different versions of that language to get signed. I don't think
So we're fairly rock solid where we're going to stand. And we hope you come along and like 574 along.
All right, delegation, Representative Long, what do you think? Well, I've already stated that I'm willing to remove 185 from 574. You're willing to stand with the Senate? Correct. I'm willing to stand with the Senate. Representative Paul.
I just want to go back. I know we're doing this, but I have a
your mic on.
question.
You gotta put your mic.
Sorry. I still am conflicted on this. And I'm wondering why we just don't put the exact same language in here. And then that way it just moves forward with both of them.
Go ahead, Senator. Press your button.
Thank you. And I think the reasoning is, as Senator Abbas has said, we believe that that issue has been addressed. And to the credit of the House moved the Senate to act on that bill. Those two chambers came to agreement, and that bill has moved on. And to complicate another bill by putting a second bill on it, just it does not seem to be good form and process.
And if I can just explain.
Go ahead,
If
Senator.
for some reason, and I'm just talking hypothetical, that the Senate version of 185, or even the House, whatever version it is, was not acceptable by the corner office, you're going to lose the entirety of Senate Bill 574. All right. So I guess the point is, if we're already sending that language once, why jeopardize what is in Senate Bill 574? I would say they were taking an unnecessary risk with the policy of the underlying bill, considering the policy itself that the House wants is on its way there. I think that's the issue here.
I find that language convincing. Representative?
I just have a process question. So if we were to separate the two bills, does this version of 185 go to the governor?
So.
We can't separate at this point.
Yeah, we can't divide them up. I guess it's just,
No, well, you're wanting to divide them off. That's what you're asking for.
No, we're removing, the compromise would be to remove the 185 language. We can't send two different bills.
Okay, because I was just confused because we concurred with the language here in the House. So I didn't know if they both go just separately. Does that make sense?
No, yes. I think I understand what you're asking, but the language that is the 185 will go on its own to the governor. 574, if we remove the House amendment and we agree, that will go by itself. It does not jeopardize 185, nor does it jeopardize 574. It will then be up to the governor.
I see.
Would you agree with this then?
I mean, I don't like it because, let me finish. I don't like it because the House literally concurred with the way it's written here. However, if this is a choice of like sudden death, then I would have no other choice than to concur with it.
and in fairness, the House position was honored in the other bill, right? Because they concurred with what we passed in the Senate. So the House did take a position. So I don't think we're doing anything. This is not going to be nearly as combative as some of the other ones, trust me.
Okay, Representative Bureau, one left. Do you want some time to talk to the others, or? Representative Pearson, do you want time, or?
I think it's 6-1, and either it will be 7-0 or it will be 7-0.
Okay.
And Representative Ball has the choice as to how.
Thank you very much
Thank
for for the discussion. And
I'm a great believer in let's get as much as we can, because we can always come back.
thank you very
And
much.
if this doesn't quite fit it for some, maybe they're right. And we'll plunk our $2 down and give it another try.
Very good. So should we have a vote on that?
Yeah, I think just, just to make sure,
We're all in agreement
the
now.
question is that what we're voting on is Senate Bill 574 in its original form will be,
Without lines 6 through 15 on page 2.
Yep. And- All right, so
All in favor?
I,
Aye.
Aye.
Do I have any ayes over there?
well, they can
Oh, you can decide on your own, okay.
you can, so we will move forward and I understand it, we will draft the report and it will be ready for everyone to sign off.
I think I said yes. right?
Yes.
Okay,
Okay,
thank
I
you.
was really so.
I'm a reluctant yes, but I'm still
Yep.
gonna.
Okay.
Okay,
Representative, I've been in your position several times. I understand.
I don't want them both to go down. I want them
Sure.
both
So do I. Okay, very good. So we will adjourn.
thank you very
Thank
much, everyone, thank you. Yeah.
Thursday morning, I'm back in this building.
All right, I will call to order the Committee of Conference on Senate Bill 354. And would the House like to speak to their version?
Okay. Okay. So in the public hearing that we had in Commerce, we had some very compelling testimony about how some of these pharmaceutical products are actually the companies are actually helping the cost sharing for people who have these plans, and please don't disrupt that. Is what they said. And so when you kind of narrowed it down and zoomed in, the comment was for people whose employers have chosen a high deductible plan, and that's there's no control for them for that. Clearly, if you were an individual in the individual market, you would just choose not to have a high deductible plan if you know you need this prescription, these prescriptions. I think it was the idea was that if there is no generic alternative, which you can see on line 16, and it's for the high deductible plans, that it would be certainly permissible for that cost sharing to be picked up by that pharmaceutical company. We did have a caveat that they need to do it the full year, not just bait and switch kind of thing. So I think it was unanimous in committee, and as the right answer to this, what we understood the problems. And the American Cancer Society told us that they liked what we had done. So yeah, go ahead.
We chose to follow the federal guidelines, what they do with Medicare, in keeping the suppliers of the coupons, if you want to call them that, or whatever cost sharing you want to call it, because I've seen it called all kinds of things, the organization supplying those coupons have to be independent of a specific drug, unless that drug is the only drug in the market for that particular illness, like the cystic fibrosis or some of the other ones that are very, very specific these days. But if there is a generic available, then the coupons would not be valid for a specific drug. And it follows the federal guidelines, seems to be working well for Medicare. People seem to be taking good advantage of it. And so the amendments seem to work out really well and answer the questions for the people with the severe illnesses that require very expensive drugs.
Well, I think my concern about that is looks like you may have changed the definition of the organizations that can provide. It looks like you probably took out charities, nonprofits, churches, corporations, employers, or online-based donation aggregators, which I understand is not the federal, is not in the federal guidelines, but it is in ours, as far as I know.
Well, what we did was we looked at where those various charities were getting their donations from. If the charity was very heavily donated by the drugs industry, then they are not an impartial organization. They are trying to push the cost. They're trying to push the coupons for their branded drugs. The federal government has already analyzed that situation. And that comes out in In the bill, it quotes the two federal laws that govern that sort of thing. And I have them over here if you're curious about seeing them. One of them is Federal Regulation 70623. And the other one is, I have so many papers,
So, to answer your
but it's
question,
already been determined.
there's nothing barring anybody from helping someone else with their copay. In other words, we were targeting the independent charity assistance programs that the pharmaceutical companies are having. But from the testimony we heard, that if a church or a community or a neighborhood or a GoFundMe was helping somebody else, there is no,
Yeah,
there's no law against it. There's no reason, that they can do it. But if you feel like we need to add that to say that, put that in the bill that reaffirms that we could certainly be sympathetic to that concept.
I would be concerned though if, well, it's up to you, but I would be concerned if the church specifically collected a whole bunch of coupons from a specific drug company.
Again, we're not talking about that. We're talking about the cost sharing, that if the church was only giving money,
Oh,
cash,
Oh, that's fine.
to help the cost sharing. I
Yeah,
believe,
that would be fine.
I believe that's what we're talking about.
Okay. Sorry. There's an echo in here. Can't help it.
So we correspond with you.
Sorry.
I think we all received a email from Gunnar Esiason of the his foundation, his father's foundation, about cystic fibrosis patients. And we also received a email from Mike Rollo, who's here, from the American Cancer Society, not supporting the House passed version. So what I've just distributed to you is a possible compromise. It strikes the independent charity patient assistance program definition, because it is highly restrictive of, what we're trying to do. Then in Roman 2 adds a third party, including charities, nonprofits, churches, etc. It strikes Roman 3 and it strikes Roman 5. Now, on Roman 5, it could be that we could find our way to a compromise on continuing with the catastrophic plan, but not the high deductible plan, because that really would be very limiting. So I would hope that the House would consider these changes. We use your basis for, your version of the bill, which looks quite different than ours, but I think this would be a possible compromise.
Yeah, I've never seen, I don't know anything about this, so,
Well, I'm just giving it to you right now.
okay. So, what jumps out at me right off, I see you're adding an individual. Okay.
Yeah, we add individual.
Right, so that our theory was that again, we were trying to focus on the testimony we had in the committee, and which it was the high deductible plans. So if an individual signs up for a high deductible plan, then they're making it their own problem at that point. So I just seeing that, I'm like, I don't know, that seems problematic to me. And then the crossing out the independent charity, it's program, which is I can play back the tape, but there was I guess he was a hemophiliac. And he made it really clear, do not take that away from us. Don't, make sure that that's protected. That, from the the pharmaceutical companies benefit. So there's, obviously, I can't make a decision, certainly we can't make a decision on this.
Yeah, no, I understand.
Yeah, we're gonna
that. I
have
mean, I
to,
think
through this, but I guess I'm trying to understand what was wrong with what we did. Is it, would you say is that it was too narrow? like
It's
the
way
high
too
deduct-
narrow. The definition referencing those federal laws is way too narrow. And from what we've been told, it excludes all of the entities that we put into the draft that I just gave you, any third party, excuse me, including but not limited to charities, nonprofits, churches,
Right.
corporations, et cetera. Okay,
We
so
have
that
no
brings-
problems adding that back in, but we were told clearly in the hearing. So I don't know where you're getting that information.
Well, the advocates of the bill have told us that, so.
Really? That okay, well, he's changing this from what I heard in committee, but, okay, so obviously we're gonna have to,
Okay, yeah, that's fair.
process this, but, like I say, I wouldn't have a problem if you wanna add in these other here, but yes, it is absolutely true that this is a health insurance mandate dealing with one of the biggest health insurance premium drivers, pharmaceuticals. And yes, we were trying to narrow it to a group that specifically was harmed because they didn't have control over their plan. But that if you have an individual, yes, we don't want them to adverse selection go for a high deductible plan, knowing that we have this legislation here to mandate that it's going to be covered for them. And therefore, is scheming the system and raising everybody's in premiums unnecessarily.
I think there's
All right,
another
so your
issue
biggest,
on that paragraph.
excuse me, so John, it seems like your biggest issue is the individual, not striking.
Right at this moment of that word there, individual is a problem
Okay,
for me.
all right, well, we can take that under advisement too, I guess.
Okay.
I'm sorry, I have another problem with this. It says biosimilars, you crossed out biosimilar or other covered alternative available. Biosimilars are very important. If the biosimilars are available, and that's where a lot of these drugs are, we really need to allow that. If there's a biosimilar available, it's less expensive, and it's been evaluated by the FDA to be equivalent to some branded drug, we need to be able to have access to that, and that therefore they should be allowed to use that and not be forced to use the branded drug. Because they can get it cheaper for a period of time.
I understand that, but if the patient is doing well on the branded name as opposed to a biosimilar or some other alternative, then you're taking that prescribing away from the physician and the patient who is doing well. So I don't think that suits the
No.
goal of patients either.
See, the problem is that the branded drug went in first. We don't even know if the patient knows that there's even a biosimilar. And we're just saying, just keep on using the most expensive drug you can. And that's what the whole purpose of why we backed down from it.
We spent a lot of time learning about biosimilars. Evidently, you killed the bill.
All right, so you have an issue with the biosimilar language and the individual. So we'll take that under advisement. And I think we can take under advisement the Roman 5 if we separate out high deductible from catastrophic, that might work, but we have to talk to the advocates on that.
So do you want to recess
Um,
and talk about it?
Sure.
What time do you want to be back?
So what, our schedule, we're next one for
I have two at
okay,
1:30.
yeah, so, yeah, give us,
I have two at 1:30. One's in this room.
It's a marvel.
No idea.
It's a marvel how we pull this off.
Regina's gonna handle one of them.
Okay. So So you're saying you got something,
I think
At
this is
1:30.
a discussion that's probably gonna take longer than 15 minutes.
I
think it would
totally
be-
agree.
I think it'd be better to come back tomorrow or Wednesday.
We could do that. But, well, but we also, don't we have, don't we get
Oh,
to
yeah,
talk about this
we're
again
on, the
today?
three of us, John, are on multiple.
Yes. We are.
So what works?
Actually, all of you guys are.
Yeah.
I
Um,
need to check and see if
Didn't we?
this room is available, but, you guys have any, tomorrow?
I think she does.
I've got one at 10.
I have one at 10 too, so you could
Okay.
come back,
So,
me, I could come back at 9:30 tomorrow. Easily,
9:30?
or probably 11:30.
Okay, let me do 11:30 then, and I'll see what room's available.
We'll find a
but aren't we talking about this same subject again later today? At what time is that one? Yeah, so we'll see you at 3:30 and see where we are at that
It's
point.
2:30, isn't it? It's 3:30?
Yeah, no, the Senate bills are,
Oh,
You attached it to
Yeah.
our House bills. Somehow you decided it was related to pubs.
we can do anything we want.
Yes, we noticed that. Okay,
So what's your?
so we'll see you again at 3:30.
So if we don't have, if you guys, if you don't haven't had a chance.
Yeah.
to confirm,
Then we'll-
I'll make sure what room's available and I'll let you know 1380.
Great.
When we're in 1380.
Okay. Oh, you're now. Right, but you want to stick around for that.
don't adjourn recess.
That's right, 'cause-
We will recess until the call of the chair,
Likely at 11:30 tomorrow.
likely at 11:30.
This Kate's
Okay.
got to post it.
We will recess to the, till about possibly 11:30 tomorrow morning. All right, I know we're running a little bit late, but I'm going to open the Committee of Conference on Senate Bill 499. And Representative Edwards, I know you said you just wanted to get our positions out there, and then we can recess till we get maybe some conversation. So do you want to let them start?
Thank you, Madam Chair. I'm sitting in today for Representative Keith Erf, who the speaker had designated to take our lead, and he's not here just because of unavoidable business travel. So what he asked me to do was to come here and talk with you all to make sure that we understood what the Senate's position was and to defer the decision until later, in a day or two, whenever, however we can come out of recess, your recess. And if you're ready, I can kind of tell you what I think the House position is.
Sure.
Okay, I believe the House position is SB 499 as amended by I think I'll refer to it as the Tulersky Amendment, which had SB 499 have two major components to it. The first component, whereas nobody's disagreed, is to improve the senior eligibility process to make it easier for them. The second part that was some debate within the House was whether or not we should do the summer EBT program. And that did pass on the floor. That is the House position. And I'm assuming that the language that got incorporated into the version that we would be voting on is word for word, comma for comma, what passed the House. I haven't done a comparison, but it looks the same to me. If it is identical, then I don't see where the House would have any grounds to disagree. As I understand it, that the Senate may want to have us all consider another requirement for the disaster relief component of the bill. The disaster relief component, as it passed the House, was meant to create an expedited way for municipalities to get some emergency funding relief rapidly. And the perception has been, and I guess the experience, I've never dealt with it personally, but the experience has been that federal disaster relief declarations can take a while. And meanwhile, our towns are left to suffer a bit. And so there's some contention over or not that would be an acceptable addition to this bill. But the House would not be in a position to say yes or no today. But if that's your position, then I think we've heard you and would like some more explanation from you maybe on why that's important to the Senate.
Yeah, thank you for that. I think that's helpful for us to understand. I think the Senate position is the bill as we passed it in terms of 499. So the Senate position, in addition to the Tulersky Amendment, also includes free and reduced lunch, which was, I think, a price tag of about $500,000. So that's the Senate position. So I just wanted to be clear about that. I think it does sound like we're willing to have some conversation about disaster relief, but that's sort of predicated on, this conversation about 499 as well.
And I have a tendency to agree, and I think if we are going to pass it with the aid to the municipalities, then I think we should be able to add pieces of the Senate version back into the bill. Including,
Back into 499, the food bill?
Yeah. The free and reduced.
Yep.
All right, so I think if I may, I think we do have a fairly clear, certainly not a unanimous House position, but I think an unambiguous votes on this have been that asking the schools to participate more in feeding our students is inappropriate at this point in this bill. The schools are already struggling in post-pandemic life to fix the damage done to academic outcomes. And the focus of the public schools ought to be on improving academic outcomes. And asking the schools to do more that distracts from their core mission is not something I think the majority of the House wants to do. So I don't believe the speaker would want to do that.
Well, I sort of want to clarify, we're not asking the schools to do more at all. We're just asking to have more kids eligible for federal money. So this is a critical piece of policy because we know 1 in 12 children are hungry. And so this portion for a very small amount of state dollars are going to allow schools to access more federal dollars to feed hungry kids. And so that is a critical piece of this puzzle that, you know, I think the Senate position on the disaster relief bill was clear. It's not something that we supported. And if we are going to consider it as part of this, I think we do need to include that.
I agree.
All right. So I thank you for your additional comments. I don't know if that would influence the House position. But I don't think we need to decide today. I think we just need to go back and huddle and come back prepared to just say yes or no.
Yeah, no, that makes sense. Maybe we could look at our schedules. And I also did want to clarify in terms of this is not an additional burden on schools. These are state dollars, not local school dollars, not local community dollars.
Okay. So and I know Marie is listening in the netherworld up there. What is your availability to reconvene? Because I'll,
Do you want to look at?
Well, to answer the question, I would start with Representative Erf's availability, and he tells me he's available tomorrow or Wednesday.
okay.
And
I've got
I would
one.
certainly change my schedule. I have one thing scheduled tomorrow and one thing on Thursday.
I could do tomorrow at 10:30 or 11:30.
I've got 11:30. I've got a 10 and I've got 11:30.
10:30?
Um,
Is that too tight? What about the afternoon? I have a 1:30 committee of conference, but I could do,
about noon
Are you talking Tuesday or Wednesday?
tomorrow.
tomorrow.
Tomorrow?
I could do noon tomorrow.
I could do noon tomorrow.
Is everybody okay? So why don't we do noon tomorrow? Maria will figure out which room's available and let us know. So I am going to recess the committee of conference for Senate Bill 499 till noon tomorrow.
Thank you.
Great. Thank you.
on Senate Bill 407. And I know Representative Hunt's not here, but would you like to present? Okay.
So what we did was we looked at how many ambulance claims there were and who made those claims. So remember that we only cover our responsibility legislatively is only to the small and large business fully insured, small and large groups, fully insured groups. We don't do anything with Medicare. We don't do anything with self-funded, so we can't do that. And it turns out that 64.3% of all claims are Medicare claims. And the way the bill writes it, to make up for the losses that they're facing with Medicare and another self-funded is another 10.4%, Medicaid is another 12.5%, that we were taking the cost of all of that and funneling the responsibility onto just the 8.6% of fully insured. So what we needed to do is find out of the fully insured claims, what was actually the responsibility. So that we weren't going to be paying, so that they were not going to be unfairly taking up the burden for everybody. Unfortunately, the ambulance services, for the Medicare part, they're going to have to negotiate with Medicare. They can't, we have no responsibility there. For the self-funded, they're going to have to negotiate with those companies. We have no responsibility there. So we wanted to go, so our law was changed, the bill was changed to reflect the fact that we're going to have to figure this out. Because to make the funding fair for the amount of people, the 8.6% of people that were being hit with this whole bill. So that's why we changed it.
Okay, thank you, Chair Birdsell, and welcome colleagues from the House to talk about 407 today. And I want to say, starting off, that I do appreciate your work and agree that the cost study that you have plugged into 407 is something that we want to do. But I want to take us back to some of the other issues and see if there's a middle ground for us. So Representative, it's Spear?
Spear.
Okay, I was going to Spear. Representative Spear, I appreciate what you just said, but I do want to point out that although you're talking about shifting the costs potentially to the small plans, right now where those costs get shifted are to the communities. And so I'm gonna respectfully roll through my introduction and then we can go back and forth. So it does get shifted to the communities. And as you've outlined.
Excuse me, sorry, could we do a reset? Because some of us weren't in the room when you
Representative,
guys started the
thank you.
meeting. Thank you.
No problem.
Yeah.
Oh, I said, essentially.
Representative, can you put the,
Sorry, that we can't put the entire cost for the ambulance service. When 64.3% of it goes to Medicare, we have no responsibility for that. Another 10.4% goes to self-funded, we have no responsibility for that. So what we wanted to do is change the law, change the bill essentially to reflect that we're going to study and figure out how much the 8.6% of the fully funded is actually our responsibility and find out what the costs were there.
That's all. But thank you for asking. So I talked about the cost shifting that's already ongoing to the communities. So let's talk about the roles of the communities in New Hampshire, because we're only talking about in this bill emergencies. Okay, so 911 calls or a call that comes into a dispatch center that's an emergency by a 7-digit or an unscheduled interfacility transfer. So that would be like a major, say, trauma patient or someone having a heart attack at a community hospital that needs emergency care. So we're at a tertiary, a larger hospital. So that is our population. It's not any of the scheduled related transfers. And with that, what happens is that these communities, again, the cost is being shifted over to them now, and that communities decide what kind of emergency medical services they're gonna provide. So it's unlike other healthcare systems. It's unlike hospitals or doctors' offices. This is a different type of model. The communities say, like I live in the city of Lebanon, and I can, speak for some of the other communities in my district, but just since I'm most familiar, the city of Lebanon says, look, they've looked at their They look at their volume of calls annually. They look at the type of care that the patients require and made a decision for how many ambulances they'll staff, what level, because it's not always a paramedic level. Sometimes it's an EMT level. My primary point here is that it's unlike any other healthcare system, and that communities actually drive the choice based on what their needs are. So that, I think, it just puts us in this different place. And again, I've already talked about emergency, and the reason that we came in with the town set or community set rates, because cities are towns, okay? And either the community set rate or 325% of that is that the communities, when they are setting their ambulance rates, they do it in a public process. There is, and I again know this from my own community, but others where I've been able to observe this, is that it's an ordinance in the city of Lebanon. And I don't think we're the only city that does it this way, where they, once they've made this assessment, they have to actually bring it to the city council if they're going to set the rates or change the rates. So we're assuming right now that everybody is in already that's going to be in, and so if we're going to change the rates, they have to bring it to a public body and debate it in a public body, and people who are responsible for citizens have to raise their hand. And this is the last thing that I'll say for now, where on the other side, when you're negotiating a contract with, to be a network, which is a big part of this discussion and problem, that's all done with an NDA over it. It's like done not in a public process. And so that is what you accept when you go into that. But I've been pushing trying for this particular purpose to do this and value the hands of those that are raised and representing the taxpayers, especially since right now they're holding the full weight of this when the shifting takes place, in my opinion. Or I should say the full weight, but a large piece of it.
Thank you.
Well,
The problem I'm having, and maybe you could explain, is that in the end, though, it's the insurance carrier that pays for this. And if it's the insurance carrier that's paying for it, and it's only those insurance carriers that are paying for this, now, towns can certainly pay for it, in which case we have nothing to say about it, at least in the context of this bill.
yes, understood.
But if we're talking about the insurance carriers covering for it, then we're only talking about the 8.6% of people. And if a town has, in some bizarre way that it could, have only people that are over 65 years of age, these insurance carriers can't be held responsible for that because that's all under Medicare. You see what I'm saying?
I do see what you're saying, and the 64.3% of Medicare that you brought up earlier shows what a small problem this is, but it's a large problem on the industry where that the ambulance services are, at least, that the ambulance services aren't paid directly, which I know a House bill addresses now. And we could talk about the whole prohibition of balanced billing, but I just think that you raise a good point, but those people, their beneficiaries are expecting an ambulance when they need it for an emergency, and they're expecting an ambulance when they need it for an interfacility transfer when it's an
Absolutely.
emergency. And we're in a position now where our system is right on the brink. So wouldn't we want to try to fix the current system even temporarily, and then again do what you brought forward, which is part of a potential compromise, which is this cost study?
Well,
I hear what you're saying.
But then I have this one other issue. Right now, we're at 4.8% uninsured. That is phenomenal for this state, because 2 years ago, it was 6.1%. If we would make this 8.6% of people, of insured clients, pay for the entire thing, the Medicare part and everybody else's part, we're going to have to raise rates, and we're going to go up from the 4.8% that we finally have gotten. And I find that's a tough trade-off. That is really tough.
So I guess I want to just add another piece to this. And that is, I would say over the 30 years plus that I've been on commerce, this has been an issue.
Yeah.
Always been an issue. Okay. And each year we come back and this year we did something that we haven't done in my entire 30 years to say, okay, let's do direct pay. Okay, so I hope you understand that we, in the House Commerce Committee, which is our primary responsibility, is insurance premiums. Okay, and that we're absolutely, we're trying our best. We did some, but what we have come up with here is the long-term solution. Because at the end of the day, the problem is Medicare. That's the lion's share. That's the problem. What we are planning to do, and maybe it's hard to read it in the way we wrote it this way, but what our plan is that we will be looking for a waiver from Medicare. And someone who sits on the oversight committee for waiver requests, we have done it multiple times. One of them, for instance, that we have right now is a subsidy for the individual health insurance plan that we have, the marketplace, is actually an assessment on all insurance products in the state, and Medicare then gives us some money. So what we want to do, what we're doing with this plan is that we're going to do this cost analysis. And then once we have the cost analysis, we can then ask for that Medicare waiver. And then we will, at that same time, that same assessment will then go on to the insurance companies this little 10%. But it's going to be everybody. And so therefore, it's the fair way to do it. It's the right way to do it. I realize that's, for you, like you thought you had a bird in hand that you're going to get this all solved, like have the insurance companies to pay for it. But we're just saying no one says that the insurance company shouldn't help out, should pay their fair share. Okay? But they should not pay for the fact that Medicare doesn't pay. And you're absolutely right. Who's making up for Medicare and Medicaid? The towns, the taxpayers, who pay for Medicare and Medicaid, theoretically. So all we're trying to do is come up with a long-term solution that will fix this problem once and for all. It is very frustrating that they only did it for helicopters and not ambulances when it came to the balance billing issue. But at least we have an opportunity here to get a long-term solution.
First of all, she did not come with a bird in the hand. She actually came with a position that she felt she was getting a solution, not just a bill passed.
Well, the solution that was unfair for 10% of the population.
Thank you, Senator Birdsall. So, and Representative Hunt, I do appreciate what you've had to say, but I think we're focusing this discussion on Medicare instead of focusing on you brought it up, what you have control over, what you don't have control over. And so we're starting to talk about what we need to do to change Medicare. And I agree with you on that. But what we have within our purview right now is a system that is faltering. And we could put an immediate fix in place and then this long-term fix and try to work this out. And I also respectfully, it's the same argument that I hear about what's happening to the insurance companies. And, I know everyone's represented here, so I'm being very careful about how I choose my words. It's the same argument. And what I have to wonder is when are we going to shift ourselves towards the patients? And I believe with what you all did with balance billing, not balance billing, I want to talk about that in a second, with direct pay was a real big step in the right direction. And I'm very thankful for that. So please understand that I'm not ungrateful in any respect. I'm just trying to argue for a short-term solution and a long-term solution. And lastly, you brought up balance billing, so thank you for doing that. Yes, we can still balance bill, and we've offered to prohibit that, and we'd like to prohibit that in the context of a compromise. But there was a federal committee, and I actually sat on the federal committee, and the recommendations had been made to Congress. So the longer that this goes on, the federal the federal recommendations, if Congress picks it up and actually moves on it, then we'll see balance billing get prohibited. And Congress didn't include ground ambulances in this because it's so complicated. And we're all facing exactly why it's so complicated. So they didn't include it for that reason. We've come up with a series of recommendations, and if they act on them before we do, we can end up in a situation where we're going to take what the federal government gives us rather than what we want. And what's in here is closer to what would work for New Hampshire.
You mentioned about caring about the patients. And,
Keith,
oh, I'm so sorry.
Simple question. What about the House version do you not like? If you could just identify one or two major issues.
The House version is fine with the cost study. We like the cost study is fine. However, we do feel that at least we should be getting at least a year pilot program for the ambulance services.
So thank you, Representative Hammond, and I did say earlier that I like the cost study. I am not opposed to that, but what I'm arguing for is to try to get back to the table and see if we could even phase in some predictability for the ambulance services. We could prohibit balance billing. We would adopt, and we've already pointed in 407 to what's currently in a dispute resolution process that could expand with the implementation of Senate Bill 173. And then we would be in a position to phase that out once we know what the cost study says and agree to a permanent solution. That's all I want. So I like
The cost study. So
but I want mine.
if we implement a mandate and do the cost study at the same time, wouldn't we be tainting the data by manipulating the market at the same time we're trying to study the market, right? So isn't there a conflict there?
I think there's a lot of data prior to this that they can fall back on to get the information for the cost study.
did you say in your version you got rid of balance billing?
No, but we would. I offered during this process to prohibit, to go with the 2-year, but now I'd go with the 1-year version of town set rates or 325% of Medicare, whatever the least. We would go forward with prohibiting balance billing. We again would point to the dispute resolution process that's already in law or will be updated. I would love to put cost sharing in because the federal program is going to cap cost sharing at $100, but it doesn't look we have the link to make that happen. But that's what I wanted to propose.
Well,
As a compromise, and we might well be ahead. And I know Representative Spear wanted to say something about patient care.
Well, I was just going to say that was in either bill, and that is a whole different concept. So that is non-germane to be putting into either one of to our committee conference.
May I? Yes. So thank you. I would disagree because we've talked about all of these elements. And we can get a ruling on this, but I did bring this forward to the Department of Insurance during the 407 negotiation. Was told that the commissioner couldn't agree to it. So I'm not bringing anything back that we haven't talked about. I'm just bringing back a different way to put this forward. I mean, all these things, 325, community set rates, 325% of Medicare. We've talked about prohibiting balance billing, although the language wasn't in here. I can't see why we wouldn't adopt that because we've talked about it. The only thing we haven't talked about is cost sharing. Direct pay is in there, but that's already covered. I mean, we have an opportunity here to take what's already been vetted in the public forum and just reshape that.
Question I have, and I touched on it a little bit, is that if we have 325% of Medicare being put on the 8.6% of people that use insurance in this state, I'm sorry, not the country, in this state, and those rates go up, and we force people off the insurance rolls, and we get back to our 6.1% because they can't afford it. The biggest thing that they claim why people don't get insurance is because they can't afford it, can't afford the premiums. If we raise the premiums and lose those people, those costs are, any cost savings that we have are going to be gone. So without being able to find out what's going to happen to the insurance rates, I'm a little reluctant to move.
I hate to bring this up, but should we recess?
What is he doing?
I'm sorry, recess.
Okay.
Germaine, non-germane for this day. To have the rural ambulance services rather than going through this.
Through the insurance.
Instead of going through insurance, we have a state contact.
That sounds like a great idea.
That's what I think we should do.
And based on everything she's saying.
Okay. My suggestion is, oh, did you want to, sorry.
Yeah, so, again, this has been a problem, it's always existed. And that it's unique that we now have an opportunity to solve it. We have some members here that says this, well, we did help out the community hospitals, and you want to share what you think we should be doing here?
Yeah, my feeling is obviously it's a little late in the game for this, but instead of penalizing certain policyholders, why can't the state carve out some money to help out like the rural ambulance services that are the ones that are struggling? Why are we gonna penalize the insured and small pockets of the population?
So notwithstanding that concept, which obviously that would have to wait till next year for separate legislation, the idea that we can get this economic information from the insurance companies, and I did consult with the department, and yes, we really do need this bill. So we're begging you not to kill it. Okay, we're begging you to accept this committee, to get this going forward. If you don't, then I'll just have to put it in next year and hope get it done next year. But that we're telling you, if you truly want to get this problem solved for the long term, then this is the first step we have to take to get that Medicare waiver.
And I will say, I think if you truly want the cost sharing, maybe we should recess till Wednesday.
Cost study.
I'm sorry,
Fair
the
enough.
cost
Cost
study.
study and cost sharing, two different.
Yes.
The cost study, recess until, let's say, Wednesday, and see if we can't come up with a compromise.
Okay. Do you want to
Find out what the schedule.
just, you want to do like you do, just, recess until Wednesday and then we'll figure out a time and date later? I mean, all I can tell you is right now I have a 10 and a noon on Wednesday.
I will be here actually I'll be here at 8 a.m. on Wednesday. Do we want to do 9?
Hold on, let me just check. I only have 5 on Wednesday. Let me just check if you can. I didn't bring my computer with me.
Tuesday's starting to get
Wednesday?
crowded.
I have 9 tomorrow. The day
Oh, wait
after.
a minute.
Yeah.
I'm sorry, that was last week. What's your schedule like for?
I'm okay with 9 o'clock. I would prefer 11 on Wednesday.
All right,
11,
that works.
okay.
Does that work for you? 11?
I haven't heard
11
back yet.
a.m.
I'll flip whatever I'll get a substituter. Done. I've got my calendar.
Okay.
So
why
And
don't
this
we-
is Senate Bill 407.
Yep.
11 a.m. Everybody okay with 11 a.m.? No, 11.
She's gonna,
Do we? I have
Tanya's gonna tell
10.
us whether the room is available.
We have 12:43 at 10.
Wednesday at 11?
Didn't you schedule 3:54 for 11?
Not yet. We haven't scheduled that one yet because we were going to talk about it.
I am free at 11. Not that everything depends on me, but yes, I am.
Huh?
You are free.
Yeah.
Well, we could do one of our committee rooms also.
Yeah, we're good. 11 o'clock.
Okay, 11 a.m. it is.
I think you're thinking of 11 a.m. tomorrow.
I'm saying 11 a.m. June 5th.
There's a 3rd to the 4th, 5th.
Yep. Got it.
We're gonna do 3:54, 11 a.m. tomorrow.
I believe
Okay.
so.
Unless we talk about it this afternoon.
Right.
3:54 at 11 or 11:30. I
Okay.
can't tell what that says.
All right. Otherwise, it's 2:30 and let's talk about 555.
We have 555.
This is their folder, so.
I think so.
Hi, Jason. Good. I'm sitting here down in center.
Are these the files?
Uh,
555?
100.
This is yours. 555. No.
I can't. I'm not sure when it'll be because we're
Are they for the-
busy through 3 something,
Whole group of
but 3:30.
Yes.
But I'll come up as soon as I'm done.
Oh, it's your bill.
All right.
Is it your bill?
Talk to that.
Sorry. Anybody want a pre-prepared folder on 555?
Sure, if you have it pre-prepared, why not? Yeah, you got staff.
Always sharing.
FYI, 354 is for tomorrow.
Third.
So that's the what, 11? So which one is that? That's. Right, but that's 3, yeah, you go online, 354, 11:30. Okay. Okay.
All right, I am opening the committee of conference on Senate Bill 555, receipt of pharmaceutical rebates by insurers and pharmacy benefit managers. Kevin?
Yeah,
Wait. I was,
good.
let the House go first.
Okay. Sure. All right, so, we're not gonna, hopefully, we don't need to explain to you why we think this will increase premiums in health insurance. If you're not, we can do that. But you do understand why we believe that? Why we think?
I understand that you believe that.
Yeah, okay. So you might, maybe don't agree. Okay, so, ironically, this, I assume you knew this when you put the bill in, that the statute that enabled this was being sunsetted. And ironically, that was Senator Bradley's amendment way back when. I was kind of happy to, because I never liked the bill in the first place, but I was in the minority at the time when it was passed. And, but in its effect, and I guess one of the good things about having a bill and having a law on the books for a period of time and then seeing what happens, that the benefit is, that you can now pause and think about it and look what it did and what the impact was. And what was interesting was that of our two major carriers in the state, that each one of them went completely opposite direction with this. One was the terms of, make sure I have the right bill, right? Okay, they're having, one decide to fully pass on the rebates, 100%. Well, we generally don't like to say names. The other one said, nope, we're going to just use it to reduce premiums. So again, I would then say, all right, you do understand how the minimum loss ratio is calculated, right? All three of you understand what minimum loss ratio is?
I'm pretty sure you do.
Okay. All right. So absolutely, the first thing I did when I saw this bill is I asked the insurance department, is it true that PBMs are hoarding or stashing money away, or that it's not getting reported, that it's not in the MLR? In other words, when we look at what these two different companies are doing, the impact of one of them, in which is taking those rebates or whatever the coupons, whatever you want to call them, and using it to reduce their payout for that pharmaceutical drug, absolutely shows up in the calculation of the minimum loss ratio, which means it then shows up after the 3-year average to reduce premiums. Yes, I actually have that company for myself. The other company has decided to use it marketing wise, use it in a different fashion. They want to make their patients or clients feel warm fuzzies that they get these coupons and rebates. So they're not using the money to reduce premium. They're using the money to make their patients, customers happy. Meanwhile, we get this bill which says 50%. Are we cutting the baby in half? 0 to 100? Are we telling the companies what they should do or how they should do this? When clearly we have a competitive marketplace here with each company doing something totally different. Now, I don't know about you, Kev, but I'm a Republican, and anything that says you're trampling on free market, that's a bad thing. And so therefore, I was able to convince our committee that we should repeal the sunset. We should let the free market do its thing. But we have an opportunity now to educate everyone about the minimum loss ratio, to make sure everybody really understands that the PBMs are no longer using that money as compensation from their employer, which is the health insurance company. And let's get that out, that information out, and that hence why our plan is that the department will issue a bulletin. They will get that, because basically it's secret information, right? This is their secret formula. I mean, in terms of did it really work for the company that was offering 50%, or 100%? Was it really working for them? Whether they continue to do it. But we can at least look at how much money was being used, how much those rebates were. The department can print that without telling us which company is which. Okay, so we can get some information. We can get a better understanding that PBMs are fully indebted to the insurance company, which clearly some people are not really, comfortable with that thought. They still think PBMs are some evil empire that we're stuck with. So to me, what the solution from what we said in the House is keep it alive, keep it doing, and let the free market continue to do what it's doing. And whether it's, why do 50? Why mandate something when clearly the companies are choosing different routes?
Senator Abar.
Well, thank you for that. I appreciate that. I do know that because of the mandatory reporting, we discovered that one of the insurers locally are doing it at 100%. I think we had a little conversation on the elevator, and you said, well, that doesn't make it right. I believe those were your words.
Well, I was ready to do it. I was ready to.
Yeah, well, I'm glad that
I changed my mind.
Glad
I'm
I
sure
had that
everybody hears
influence on
I changed my mind.
Well, but because of the reporting, because of the mandatory reporting, we discovered that one of the companies is actually doing it at 100%. We had to do that through discovery. I could name the name, but from what I understand what you just said, the people that are doing it the company that's doing it at 100% right now, did their premiums go up?
Everybody's premiums go up
Thank
every
you.
year.
They all go up. They all go up.
Yeah.
In the free market, they all go up. I used to sell insurance. I know. I was licensed years ago. Health insurance. Yes. And I starved, by the way. But I think it's a bogus argument that it is a free market situation here because a lot is being done in secret. And I think that the mandatory reporting is important. Other states are doing it at 100%. We're asking at a 50% compromise, where one of the local companies is doing it at 100% and their customers are happy. We're asking for 50%. We're also asking if you don't mind, 50%, we'll let it sunset in 3 years. We'll have a study committee to look at the issue of cost shifting. And the department can report back to the committee to show, what the results are. But, I'm in homes, man. I'm in homes all the time. And I see the people that are struggling. I mean, I'm in their homes.
and I'll repeat this because I said this in committee. Lady, I had to clean up a flood after. She's got her change lined up and her prescriptions are right behind her change. Man, I'm looking at this. She's struggling. $50, $100 means a lot to them. $50 means a lot. I mean, I see it. We're asking for a little change. We're asking for 3 years. We'll sunset it. Let's get a really good handle on the information that's coming out. Be a wonderful compromise. And I promise you, and you have my word, that I'll stick to the findings. And maybe we can educate ourselves on that situation with the, I forget what you're talking. Yeah.
Minimum loss ratio.
Yeah. But we'll keep that in as part of it. But I think, you know, I'm asking for, throw me a bone here on this one, and I will definitely keep my word that we'll go with the findings. I'm sure it wasn't, but I'm just telling you that this is how I feel about it, and I understand if you can't compromise, I totally understand. But I do believe that when you brought up the fact that
I would say we are compromising because we are continuing it. Okay? So that we're not letting the sunset kick in and ban it altogether. We are compromising. I did change my mind and let it go forward because there's one company that is passing it along. And I would assume that for all intents and purposes, that it was successful for them, that their patients were ecstatic that $50 that saved them out that month, and that's why they'll continue it. So not by bypassing what we did, you're actually giving that person the full 50 rather than cutting it in half to 25. Because that company has to be in compliance with the legislation. So by leaving it, let the free market decide what's the right number. I am sure that company will continue it because it was successful for them. Let me put it this way. Their patients who are rolling over and keeping the plan will be mighty unhappy if they took it away from them and didn't do it, let alone cut it in half. And they'll say, well, where's this outrage? They cut it in half. Well, oh, don't worry, the legislature did that. No,
So-
I think what you really want is to pass what the House passed.
I disagree because mostly with the reporting requirements, because, you know, granted, okay, we get a bulletin from the insurance commissioner or the insurance department. What happens if that commissioner is gone? That bulletin, I think that needs to be in the RSA.
That's fine. If you want to take that language and stick it in the RSA, that's fine with me. We are concerned to make sure we're asking all the right questions, and we're locking that into the statute. But if it turns out they're different, then I will put a bill in next year to correct it. Representative.
Is it okay to go? I would like to hear a little bit of explanation about the reporting aspect in the Senate version, if you could just enlighten us on that.
Well, from what I understand, the reporting in the past was basically an attestation, whatever the heck that means. But we want a little bit clearer understanding as to how the premiums are actually being reduced, but with your quote free market. I'm all for free market. I think I don't believe that narrative. I don't believe that's the issue here.
The reporting requirements is how we found out that there was an insurer that was giving 100%, because in committee, we were hearing no one's doing this, no one's giving the rebates. that reporting requirement, they did request it, and that's how we found out that there was an
It wasn't
insured.
offered. It wasn't
Correct.
offered, we had to dig to find it.
And
So-
that's why I think it's important that the reporting requirement, the capability of having a reporting requirement is in the RSA.
Like I said, I'm all for the reporting requirement because evidently, I haven't educated you enough to understand what the MLR is about.
Well, I'm all for education. You can teach me all day long. I can learn. But I think right now, I'm just asking just for a 3-year little 50%.
No, we can't do that. We can't do that. We're willing to help you out understanding what the MLR is, understand what the savings is, and let's look and see what the actual dollars are. Maybe that'll be very interesting to see how much savings. But I truly believe that if you're saying that your constituents or that they really value that $50, why in your right mind would you want to cut it to 25?
I don't see how it's cutting to 25.
Because the bill says says you're cutting it 50%. That company right now is paying it 100%. So that $50 is going to be cut to $25 next year.
We're not forcing them that's doing it at 100% to cut it to 50%.
What? Right now it's 100%. This bill says 50. I don't know what your math, but that cuts in half for me.
Hang on, we're not stopping them from doing it at 100%.
Oh, okay. So at least 50%. Okay. I take it back.
Thank you.
I did not see the at least.
I was confused.
I was looking at the 50.
Thank you.
A comment was made that you're not clear on whether or not this would raise the rates. We studied 4 states. We studied California, we studied Medicare, studied West Virginia, studied Colorado. They spent a lot of money on it. It raised rates on an average of 15%. West Virginia, we were told, raised their rates 13.5% just prior to putting their law in place to make up for the fact that now the rebates would be there. And as I said in the previous bill, we're down to 4.9% uninsured, 4.8% uninsured. That's a record for New Hampshire. If we raise the rates 10%, we're going to lose people off that roll. That's going to be so much worse than having to pay an extra $100 for a drug. And so the trade-off has to be 4 states worth of analysis, do the real work, do the real analysis, and find it. Or just knock them off the rolls. And I'm not prepared to do that.
So what you're saying, Representative, is that they raised the rates before this bill was enacted.
It takes approximately 2 years of actuarial analysis to figure out if the rates go up. But states have already done that analysis. So West Virginia raised the rates prior to the law going into effect. Now we have to wait 2 years to find out what's going to happen. It takes 2 years to find that analysis. You don't get it the day after you put the law in effect.
Correct, so they raised their rates prior to this being
Yes,
enacted.
they did. Yes, they did.
So that would mean then they're potentially going to have to, according to your logic, is they're gonna have to raise them some more.
No, they may not have to raise the rates at all. We don't know yet. We literally do not know because it isn't 2 years after the law has been, maybe 13.5% was enough, maybe it's not.
So the company in New Hampshire that's doing it at 100%, they're,
Okay, we have 2 companies.
Yeah.
One is small and one is very large. The very large one has a lot more, a lot more risk pool to deal with. The one that's very small does not.
and?
One can afford to do it, and they don't do it every year, by the way. They do it when they can. In the case of the other company, they can't do it. They've chosen to lower the rates. Both of them have a flexibility with the way the law is right now to be able to do what they need to do to meet the minimum loss ratio, provide good service, and keep the rates where they can afford to be kept.
I'm going to move for.
Without an analysis, putting that at risk is a very dangerous thing when we have finally got below 5% on our insured rate. And by the way, our underinsured rate is 20%.
And
which is embarrassing.
I'm going to call for a recess right now.
All right. Yep, sure.
All right, so what I'm going to suggest and ask is that you consider, we're recessed until tomorrow, because we still have 1380, and think about the 50%, I'll drop it down to 2 years instead of 3, and a sunset, and then we can get back together tomorrow. Sonia's going to come running in here shortly and tell me when we have the room available.
Or so we need a big room.
Tomorrow. You guys available earlier in the morning? Like
8 o'clock.
no,
10.
9? Exactly.
I'm up.
All right, how about 9:30? Tomorrow. Uh-oh.
Hi, Sonia.
9:30 tomorrow morning, Sonia? Okay, we're good. This room tomorrow morning at 9:30. Mhm. All right, I am, Committee of Conference for Senate Bill 555 is recessed till tomorrow at 9:30 right here.